Welcome to the latest webinar in Caring.com's Digital Marketing Academy. Our session today is about online reviews and the healthcare privacy law HIPAA. I'm Denise Grob, a marketing director here at Caring.com, and I'm joined by a reputation management expert at the organization Consumer Fusion, who I'll introduce in more depth in just a moment. Before we dive into the presentation, I want to let you know this is a one-way webcast where only the presenters speak. You can ask questions at any time during the session, and we're going to do a Q&A at the end. And the number one question we get is whether or not the session is being recorded and if the slides will be available. The answer is yes to both of those. You may see a red dot flashing on your screen. We are recording this session, and we will be sending you the slides tomorrow morning. This session is free of charge and sponsored by Caring.com. For those of you who are getting to know us, and as a refresher for our partners, Caring.com is a leading referral service for senior living and senior care and the #1 site for reviews of senior services, including assisted living, in-home care, independent living, memory care, care homes, and more. In fact, we were one of the first to offer senior living and senior care reviews online, with some reviews on our website dating back to 2008. Currently, there are about 250,000 consumer reviews posted on Caring.com, and we add thousands every month. Each year, we compile the Caring Stars list of the best senior living communities and in-home care agencies nationwide based on those consumer ratings and reviews, and I will let you know a little bit more about that toward the end. This is a Service Excellence Award, and it was the first of its kind in our industry. Overall, we are known for hosting a high-integrity reviews program, with senior care experts, not algorithms, reading the reviews before they get posted on the website, well-established guidelines that determine which reviews get published and which reviews are taken down, and customer service staff available by phone or email if help is ever needed with the review issue. We are so excited to have Mark Spencer as our featured presenter today. He is Consumer Fusion's Chief Operating Officer. He has over a dozen years of expertise in addressing disgruntled employee and other inappropriate and illegitimate reviews online, as well as expertise in helping healthcare companies with their online reputation. We were thrilled to have Mark and his staff reach out to us at Caring.com to explore how our organizations could work together to support more home care agencies and senior living communities nationwide to monitor their reviews on Caring, and we'll keep you posted as we explore this potential integration with Consumer Fusion in the months ahead. Here's what Mark is going to cover today. He'll start by explaining HIPAA and its relevance to online reviews. He'll also share some pointers about review response and review platforms and policies, and how to monitor your reviews. We are also going to do the Q&A, as I mentioned, and a few reminders about Caring Stars and how to respond to reviews on Caring.com toward the end. Okay, now without further ado, let me go ahead and unmute Mark. Okay, Mark, and then let me also give you control of the mouse. Just one moment, please. Okay, just one moment.
Hello, Denise, can you hear me?
I sure can. I'm just trying to make sure you have access to the mouse. Are you able to move the mouse?
Let's see here. No, but what you can do is just move that slide for me whenever you're ready.
Okay.
So what we're going to discuss today is HIPAA. Hello, everyone. My name is Mark Spencer, and thank you for having me on with Caring.com. It's a very exciting HIPAA. So we're going to, over the next 4 hours, we're going to talk about HIPAA. No, I'm just joking. HIPAA is an acronym for the Health Insurance Portability and Accountability Act, which is pretty much short for keeping patients private. HIPAA prevents healthcare providers from disclosing personal health information, which can add extra complications for healthcare providers who are trying to respond. So you're kind of handheld and you're kind of handcuffed in regards to feeling like you can't do anything to respond to these reviews. So we'll work through that through our webinar today. Now, this does discourage many healthcare providers from responding to not only negative reviews, but positive reviews, even though the 80% of providers are concerned about the damage that these reviews can cause. So we'll touch base on all that today. So on the next slide, please. Now, we're going to discuss, and this affects multiple businesses across the healthcare provider platform, which is senior living facilities, in-home care providers, hospitals, skilled nurse facilities, home health agencies, companion care, assisted living, memory care, and hospice providers. So on the next slide, what's great about what we're going to do is go over the review platforms and policies, and more importantly, educate you on what you can and what you can't do and how we can possibly help you. And the next slide. Now, this is a very important statistic. 84% of consumers turn to a review site to find a healthcare provider. This is very important to make sure if you don't have any reviews, you might want to start focusing on getting more through caring.com and other review generation companies. But people definitely look into, even if they're referred to you by somebody, you still Google and find out how to get there. And when you do that, you'll run into caring.com reviews, Google reviews, Yelp reviews, Facebook reviews. So it's important to make sure you're proactive in the review sector. Next slide. Now, each review site does have slightly different policies and procedures, but each review site does have their own terms and conditions in regards to content online. Review sites such as Google, Facebook, and Yelp, but not caring.com, but they don't have the manpower, or they don't police to screen if these reviews are violating HIPAA in any of their comments. Well, the great thing about caring.com is they filter those. They understand the importance of adhering to HIPAA, and they screen for those reviews for any possible privacy issues. So it's important to know your rules and regulations per platform, but the Googles, the Facebooks, and the Yelps, they do not have the manpower to police for HIPAA. So that's where we come in as Consumer Fusion to make sure each company has the ability to respond in the right way. So what we're going to go to next is responding to reviews, what to do and what not to do. Now, 94% of people say an online review has convinced them to avoid the business. Now, this is a very important statistic because not everyone's going to pick up the phone and saying, hey, I saw that negative review, there was no response, and now I'm going to go somewhere else. They just don't pick up the phone. They just go to your competitor. So it's extremely important to address each and every review, whether it's negative or positive. Next slide. And more importantly, when someone's looking for a service, whether it's in-home healthcare or memory care, and there's a negative or positive experience, 89% of those consumers read the owner's response to those reviews. So it's very important to make sure that you are responding to those reviews, more importantly, HIPAA compliant, and B, not turning into a double negative if it's a negative review. Now, responding to online reviews, considering that most people rely on online reviews to make purchasing decisions, it's very important to implement an online review strategy for responding to both negative and positive online reviews. Now, because there's turnover in administrative circumstances, not all healthcare providers are addressing these negative reviews properly, or not even addressing them at all, which therefore could teeter people to go to your competitor and not you. Now, I want to go over some myths that a lot of people think in regards to HIPAA. A patient's review is an authorization for the provider or practice to disclose information regarding the patient. That is completely false. Just because the patient did review you doesn't mean that you have the authorization to utilize them and use their personal information to post positive or negative content about that patient, or put it on your website for a testimonial. So you would have to get that patient's authorization to do so. So healthcare organizations and providers should make sure that they're not writing comments that would confirm that the patient actually received any healthcare services. We're going to go over this a little more in detail in regards to what to do and what not to do and what you can and can't disclose. But it's very important to make sure you know how to do that. So the next slide.
It's advanced. Maybe we're on myth number 2.
Yep. If the patient posts private information about a provider or a healthcare organization online, then the healthcare organization or provider has the right to respond to the individual who posted. This is another false myth. When a patient provides detailed and specific information, and it's amazing all the years that we've done this, it's amazing what they actually post online. This still does not give you the authority to respond back with specific patient information. The more they give doesn't mean the more you can give. So just like myth number 1, comments should not confirm that the patient actually received any healthcare services with the organization or practice. This information is gained through the course of a patient's care, should never be shared on a public site without your patient's authorization. Now, these are the healthcare organization providers that you're not allowed to use or disclose in the owner's response. If you guys have all gone through HIPAA certification, they don't go over reviews in digital space. So they're kind of behind the times in regards to certifications through digital. But with this webinar and educating you guys, these are the things that you do not want to include in any one of your reviews, in your review responses. The first thing that we see tons of violations is right off the bat of thanking that patient and having the patient's name within the owner's response. Geographic subdivisions, like smaller than a state. Now, this second bullet point we see all the time outside of the healthcare sector and the HIPAA sector. A lot of owners' responses, a lot of the business owners like to put keywords in those owners' responses, like the best electrician in San Diego, California. Unfortunately, because you're in the healthcare sector, you cannot put those keywords in your owner's responses to help you rank higher. So unfortunately, your hands are tied with helping with that local SEO in your owner's responses. So from there, the next one is all elements of dates, including the date of birth, admission, discharge, death, ages over 89, or any specific information in regards to that. Admission type, what kind of procedure they had, medical record, account, the health plan number, patient's email address and or phone number, and then any other unique identifiers that pull out any form of patient information. So these are the ones that you do not want to include in any one of your owner's responses in any one of the directories. So the next slide. So here's some examples of what to do and what not to do. Now, the first one is you do not want to use language that indicates that the patient even visited your business location. So for example, a patient writes, "I had a great experience with Dr. Smith." You do not want to say, "Thank you, Jan, for coming into our office." You do not want to put that patient's information. The review response is not compliant because it clearly confirms that the patient visited the healthcare provider and that location and is a violation of the patient's personal privacy. So this is the number one example that I see all of the time of thanking the patient and having the patient's name within the owner's response. Now, here's an example of what to respond and how to respond to it. So if they come in and say, "I had a great experience seeing Dr. Smith," and then your response has to be very generic, it is our policy to provide the best care to patients. Thank you. So you're thanking them. And another thing, and back to those 89% of consumers read owner's responses, these patients spent and took the time out of their day to write you a positive review. It's very important to thank them. And those owner's responses, they see that they really care for their patients. So that is another indicator of a consumer potentially going to you over a competitor because you are thanking them, but very generically that they came and they see that you take pride in customer service. So this response that you see here does not provide any specific patient information, the patient's name or location. Instead, it focuses on just the policy of the organization, provides a polite thank you. So here's another example of what not to do. Do not use any form of details or specifics. Even the patient mentions them in their own review. So this patient clearly wrote that my migraines are feeling much better thanks to doctors in the doctor's name. And then I see this all the time in regards to the prescriptions is we're so glad, remember to take your antibiotics twice a day. That is a clear violation of HIPAA, and I'm going to send the HIPAA police out to you guys tomorrow. No, there is no really HIPAA police, but it is very important to stay HIPAA compliant. So the review response is not compliant because it reveals clearly the medical history of that patient and the prescription of that patient that they're taking. So this is a no-no. Now, here's an example of what you should do in regards to that response. So, of course, the same review. My migraines are feeling much better thanks to the doctor. Our location aims to deliver the highest quality of patient care. We love to hear about positive experiences. Thanks for sharing this feedback with us. It's a very good response. It states the healthcare facility aims to provide the best care, and it also does not confirm that the reviewer was an actual patient. It doesn't tell the patient's name. It's very vague. And unfortunately, based off of the industries you guys are all in, you have to be extremely vague to not violate the HIPAA or state laws. Now, here's another, we see this all the time of a negative turning into a double negative and turning into further online discussions. So you do not want to argue, and I see this all the time, of a negative turns into a triple negative and it just looks bad. And therefore 89% of consumers see this pointing fingers, which therefore turns into a not potential patient coming into your facility. So if a patient writes, the receptionist was rude, I'm never coming back, you don't want to allude to further online discussions as in, sorry to hear this, could you elaborate on the behavior of the receptionist? So you're fishing for more feedback in the owner's response. So this review is not compliant because it confirms the patients visited the location and will open up further online discussions about their visit. Now, this is exactly what you should do. So if the patient writes, the receptionist was rude, I'm never coming back, we are committed to providing the best patient care experience. It's our policy to resolve issues offline. Please feel free to contact us at, and then have either the phone number or the email and or both. I recommend both, just so that way people can call and email. Now, once again, this is not turning a negative to a double negative. It's going back to we're committed. You respond in a timely manner. And that's what I'm going to get into in a second is owner's responses in a timely manner, not 4 years later, you're responding to the review. It doesn't do much. So the key here is remember to keep the review response brief, general, and try to move the conversation to offline. Now, Google, Yelp, Facebook, they all have slightly different policies and procedures. And just a little Yelp tip here, along with some other Yelp tips. If you receive a negative review on Yelp, use that brief, generic, general public response that we've kind of exampled for you guys. However, they're in Yelp. Google doesn't have it. Facebook doesn't have it. But in Yelp, you can privately message that patient and continue the conversation offline and trying to resolve the situation. Now, we're talking about owner's responses. Yelp is different than Google. Google, you can edit your owner's response. With Yelp, you cannot edit your owner's response unless that reviewer updates the review. So it's very important in regards to Yelp that you have an owner's response that's not HIPAA, that violates HIPAA, but also remember, you can't go in and edit that review unless that reviewer updates it. So it's very important to make sure you do it the right way and have the right team or the right person that's in charge of responding to reviews to make sure that you only have one shot with Yelp in regards to owner response. Now, here's a little quiz for you guys to understand. So this is a review out of Google. Now, let me ask you guys this. Is this a review response considered HIPAA compliant? So it says, doctor was amazing. I would recommend her to anyone. It's a clean facility. The wait was not long. Professional staff. Thank you, doctor, or whoever it was, for healing hands and expertise. And in these owner's response, this is a true business. Thank you for your kind review. And then it pulls the username. We'll be sure to pass this along to the doctor so she knows it doesn't go unnoticed. Now, do you feel that this is a HIPAA compliant review response? On the next slide, we'll find out. Absolutely not. It includes the patient name and the name of the doctor in the review. So clearly they knew who the doctor you went to and who the patient was. So a response that is very generic but keeps it professional is thank you for your kind review. We strive to provide the best possible service at ABC facility. Now here's another quick quiz here. And this is a negative. I called this facility after my son got a facial injury playing with the dog. I described to them over the phone exactly where it was, the wound was, how big, and how old my son is, and asked if they would be able to treat him. In the owner's responses, it says, "Hi, blank. We are so sorry to hear about your experience you had during the visit with us. We would like to learn more about the details so we can determine exactly what." So they're going into details. They did provide an email. Is this HIPAA compliant? Let's find out on the next slide. Nope, because it does include the patient's name. So what you guys should get out of this is just never use the patient's name and be very generic in the responses. A response would be, "We are so sorry to hear your experience at our location. We are committed to provide the best patient experience." You always want to go back to, you're always trying to provide that best customer service. So feel free to reach out to us. And I recommend both a phone number and an email in your responses. The last one is this review response considered HIPAA compliant? Possibly the nicest staff. I found them to be professional, helpful, courteous, and caring. Thank you so much for taking the time to share your experience with us. We hope you're feeling much better now. Yes, that response is HIPAA compliant. It's generic and it doesn't expose any form of personal patient information. So now, monitoring online reviews. It can be a daunting task to monitor. There's so hundreds, if not thousands, of review sites out there, and being able to track all of your businesses for multiple locations, if you have a lot of locations, online reviews. So reputation tools, Consumer Fusion does have a platform that can keep track of all of your incoming reviews from all of the major directory sites with automated review alerts via text and email. And not only that, but we have HIPAA compliant owners responses, so you don't have to keep training the staff at the local level to respond to these reviews, and these will automatically respond to those reviews in a very timely manner between 24 and 48 hours within that new review coming in. Now, this also allows your staff to spend more time with your patients versus spending time on the marketing tasks like responding to reviews. So here's an image of our platform that we pull in the reviews from all the major directory sites. It is an enterprise platform to where if you have multiple locations or one single location, you can come in here and edit an owner's responses through Google and Facebook, and you can respond to reviews through the platform. The next step is we talked about HIPAA compliance and owners' responses to be compliant. Now, this is a very important statistic, is having no reviews or no reputation is a negative. 71.3% of healthcare organizations receive reviews from 5% or fewer of their patients. So it's important to be not only on the defense, because in regards to, we just played defense in regards to responding to the reviews. Now the goal is to be on the offense, because I'm sure the majority of your patients are happy with the services. They just don't have it easily accessible to do that. So utilizing review request tools like Consumer Fusion allows your staff to easily request reviews from your patients. But once again, you have to make sure you get authorization from your patient to send them a text or an email for that review. Also, a lot of you guys have possibly been hit by ex-employees, third parties, competitors, pill seekers, pill poppers, because you didn't prescribe them a painkiller. We see this all the time. Consumer Fusion can also remove negative reviews that violate that review's site's terms and conditions. So on the next slide, you'll see a very simple, we have an app, we have the desktop, and we can also integrate within the POS system to send out that patient review request to write a review on all the major review sites. So the next step is I do want to let you guys know there are a lot of reviews in your industries that we see all of the time that violate Google's, Yelp's, Facebook's terms and conditions, including caring.com. Caring.com has a very good process to go in there and work to see if it's being spammed, like writing a review on caring.com, on both on Google, Yelp, Facebook, caring.com. But negative reviews can be removed off of review sites such as Google, Yelp, and Facebook that violate those terms and conditions. These reviews that violate the terms and conditions can be disputed and removed from the internet. Now, just flagging the review in your GMB listing does not get the job done. Once you flag it, you want to wait 7 days because you have to. And then from there, you can talk to a moderator at Google to pick out the idiosyncrasies within that review that violate the terms and conditions. Now, this also includes photos, Yelp's tips, and Google questions. We see all the time pictures tell 1,000 words. So if there's negativity out there and they're taking pictures and that's going up in the carousel of Yelp or on your Google pages, it's very important to address those. So it is not a myth. You can remove negative reviews that violate the terms and conditions of that review site. And these are some of the terms and conditions of it. So just about, and we say just about because there's pay to play extortion review sites, but the majority of the review sites out there, such as caring.com, Google, Yelp, Facebook, they do have terms and conditions of that review site. While every individual directory may differ slightly in the terms of what's considered inappropriate, the majority of reviews that contain the following content have a very high rate of removal. As Denise explained, and we'll possibly follow up with it, is with caring.com, that's spam, which means they wrote a review, the same review on caring.com and then spammed it over to Google, Yelp, Facebook. That's grounds for removal. A personal route, and we see in your space, in the healthcare space, we see a lot of turnover for employees. So a lot of employees get fired, and then what they do is they go online and say, they didn't pay me, they terminated me, or they didn't hire me. Those are all grounds for removal. Reviews written by a competitor. We see this all the time. Don't go here, come here. Don't go there, they're horrible, we're great over here. Those are all grounds for removal by, coming from a competitor. And we also see there might be a lot of multi-locations on this webinar, but we also see a lot of reviews that are for the wrong location. We see that also in the healthcare sector. We see it a lot in the franchising industry of the review should have been placed at a different location. So we want to make sure, and that's what Consumer Fusion is keeping reviews honest. That's our motto, is keeping reviews where they belong, and the reviews that don't belong, they need to come down, and that's what we do provide. So the next thing is a lot of you listening like, okay, a lot of this is hard to digest. What we do, and we are a full-blown online reputation management company, and what we're doing based off of this webinar is we're offering a 2-month free all-inclusive reputation management pilot program for up to 2 locations, whether it's a bad location that needs help or that has no reviews at all or just a few. This will, and there's no gimmick here, it's unlimited texting and email for review generation, negative review removal where it violates the terms and conditions, the review monitoring, and then the HIPAA compliant review responses. So there is a 2-month free pilot program that we are offering because of this webinar that you can take advantage of for us to go in and help you guys out and get you back into HIPAA compliance if you're out, and to generate more reviews and remove the reviews that don't belong there.
That is so great, Mark. Really appreciate you sending that. And folks that were scrambling to capture that, we're going to be circulating Consumer Fusion's contact information, and we'll include a reminder about that offer in our follow-up materials tomorrow as well. I'm sorry, Mark, was there something else you were going to say? Did I accidentally cut you off there?
No, this is fine. So I was going to get it back to caring.com and going over caring stars and review responses.
Okay, great. And then we'll go to Q&A. I really appreciate all of the information you covered. And just before we go to Q&A, I wanted to cover a couple quick reminders, particularly for our partners in this session, about our annual Caring Stars Award. The deadline's coming up, and how important it is to respond to the negative reviews to be considered. Now, Caring Stars, I mentioned a little bit at the beginning. It's a long-standing list of award-winning senior living communities and home care agencies who have harnessed the online reviews opportunity and been recognized for stellar services. We launched this back in 2012. It was the first of its kind back there for assisted living and memory care communities that were achieving a really high volume of praise and online reviews from their customers, and they were taking time to respond to negative feedback. Now, any senior living community, any skilled nursing facility, any home care agency, hospice, adult daycare, any senior care business listed on caring.com can qualify for the Caring Stars Award if they meet the rigorous criteria that's based on the consumer reviews. Now, that's very important to note because there's a little bit of confusion, some myths out there. These winners are not determined by caring.com picking its favorites. There's no voting. It's not a random drawing. And you definitely cannot buy your way to a Caring Stars Award. Instead, this distinction is based on customer reviews on your caring.com listing. You don't have to be a partner of caring.com to be a Caring Star, but we do have inquiry tour and move-in data for those who are, and we pulled those numbers and we compared it to our partner listings that hadn't won the award, had a significant impact. We found that in looking at tens of thousands of listings and hundreds of thousands of referrals in Caring's proprietary system, that the Caring Stars winners in our partner portfolio averaged twice as many inquiries and move-ins than the Caring partner listings that hadn't won the award. That's a big boost. We know that families want to narrow their search to the best communities, and the integrity of our reviews program and extensive vetting we do of the Caring Stars really helps instill confidence for older adults and their families when they're requesting more information about that agency or taking a tour of that senior living community. And that move-in data I just shared really shows that for the senior living listings, it reinforces that these truly are the best communities, that the people they're serving are really happy with their offering, and they're willing to go online and, as Mark pointed out, spend the time to share their feedback to help others. And so every year, Caring Stars generates lots of positive content, media coverage, social media buzz. It boosts morale of staff, and your existing customers are excited when their community or the home care agency that they're using is award-winning. The winners can put the badge on their website and their newsletters. It's social proof of high quality services. And all of this makes great content for your social media profiles. And we typically announce these winners in November and the home care winners in December. But we celebrate Caring Stars all year round, and we empower the winners themselves to do so as well. Now, mark your calendars. The deadline for Caring Stars 2021 is October 15th, so next month, only a few weeks away. We don't release the exact winning criteria in advance, but we did a deep dive reviews webinar this summer. We held it in June, and we did an encore in July, and we shared these goals for you to aim toward or exceed to be considered for Caring Stars 2021. The one that's most relevant to today's session is the requirement to address all negative reviews on your listing, either by contesting them for factual error or getting them removed by deadline, and by publishing, if they can't be removed, if it's strictly opinion within the guidelines, publish a business response. That's what we consider a resolved negative review. Now, we are looking at public data on the caring.com listing. So if you think you resolved the situation with the consumer, but that negative review is still on your listing, it still counts toward our consideration for carrying stars. So we really need to get those responses published by October 15th while you work out the details with the consumer of retracting their review. If you have any questions, reach out to reviews@caring.com. We can help you with this. Okay, now some of you who, particularly those of you who are partners, you want to know how to respond to reviews on Caring. Our partners get automated alerts that's set up on their account with their account manager. They could also for the senior living communities, there's a feature in our partner portal where you can self-serve and entering those emails. And when we send you a new review alert, there are two links, one to contest the review for guidelines issues or to get it removed, and one to publish a public-facing response. On caring.com, like Mark said, it's important to respond in a timely manner, but the good news is on Caring, unlike some of the other sites he was referencing, we don't date your response, so no one sees the time difference between your review and your response on caring.com. So don't let that stop you from responding to the older reviews, because if you don't, it will disqualify you from carrying stars. Now, for those of you who aren't partnered with us, you can still respond. You just have to do it manually by emailing reviews@caring.com until we're integrated with sites like Consumer Fusion. Okay, we have covered our reminders. Let's dive into our questions. This is a question for Mark. What happens if you violate HIPAA? Are there fines? And if so, how bad are they done by how bad the violation is?
That's a great question. I just responded back to Dale on a question. So with that, HIPAA violations, just so you know, and I kind of mentioned this earlier, is HIPAA is a little behind the times with the digital side of things in regards to online review sites. So in my world, I have not seen anyone, well, our clients don't get because we're HIPAA compliant, but I have not had someone get fined for a HIPAA response and a review. I see the fines are more often into the office, or if there's a situation with a bad procedure, then the patient exposed, maybe, then that's where the fines can kick in, more of an in-office violation. And those fines can range from $100 to over $50,000 per violation, or it's actually per record that gets exposed. And the maximum penalty could be $1.5 million per year. So I have not seen it in the review response world just yet, or any violations. So if there are fines, I would say it would be minimal, or you would just update the review to not violate, and therefore I think they would just get a slap on the wrist.
Great, thank you, Mark. And here's another great question. What if the client who was receiving care has passed away and they receive a positive review? They receive a positive review online. Does HIPAA apply anymore when responding if the client has already passed away?
Well, a lot of people don't know that they have passed away, neither does HIPAA. I would still comply with HIPAA compliance, even though that patient has passed away. It was still a patient in the past and it still has a patient record. So I would still recommend sticking very generic in regards to the response and not saying their name or any of their records. So I would steer clear and still treat it as if it was a living patient.
Okay, great. And then there was a question about, and this is a great question. We see this come up a lot with the hospice reviews, but it's, do you have any advice or additional considerations for gathering and or responding to reviews for hospice in a respectful and empathetic manner that's still compliant?
Yes, I would recommend always stay empathetic, sympathetic, but you still want to be completely compliant because it is very emotional. You always want to be on the positive side of everything. So gathering right now, especially during these emotional times, gathering review and asking for a review on how the experience and giving that feedback is okay, but depending on circumstances, if it was an abrupt situation, I wouldn't recommend asking for a review. But if it's a very calming ending to their life, I would highly recommend saying, "Hey, we really want to get some feedback on how your experience was. That's a very sympathetic way of going about it. Um, and then responding to the reviews, it's the same way. Very generic. Don't implement any form of HIPAA violations, and be sympathetic in regards to the response.
Okay, great. Thank you. And then there was a question about the best way to ask your clients to provide an online review, if you had any tips that you would share with our attendees
Yeah,
today.
these are all great questions, and I want to bring as much value as possible. And once again, some of you might not want to utilize our free pilot. They just might want to ask. We even with our platform, we always educate the staff to always verbally, even know that they're going to get a text message within the next 5 minutes after they leave the facility or you leave their home. You still want to verbally say, thank you so much. It's great having you as a patient or a client of ours. Can you feel free to take the extra time out of your day to give us some feedback? We'd really appreciate some feedback on how your experience was. So that verbal asking of a review is always good, depending on circumstance and case by case. And also following up with a platform like us, to where not only do we send out that text message right when that transaction's done, but still verbally saying, hey, I'm going to be sending you a text message in the next few minutes. Would it be so kind of you to write us a review? We really pride ourselves on our response, our reviews. So verbally is by far the number one thing. Spamming, meaning sending out tons of emails that are not really specific to that patient, that's not really the way to go. But I think a more personal, intimate way of asking for the review will more apt of getting a review for the review site itself.
Yeah, and the other thing I would add to that is if there's any service issues, it gives you an opportunity to address those as soon as possible. So thank you, Mark. And for those of you who haven't yet seen it in our reviews webinar over the summer, we went through a variety of tips on asking for reviews and included a sample ask that you could use. All right, here's another question. When using names in reviews or review responses, what if the review is written by a family member and not the client? Can the reviewer still be addressed, or is it better to never use names even if it's not the client's name?
It's the Oh, it's the last one. It's you would treat it as if it is still your patient, because the naked eye doesn't know if that was your patient or not, and they might foresee that as a HIPAA violation, and therefore know that, hey, this company is not providing confidentiality. So I would treat it as a patient and respond in a very generic way, because remember, 90% of I'm rounding up, but almost 90% of consumers read owned responses. And if they feel that you're airing out your patient's laundry, then they're probably not going to pick up the phone and utilize your services. So I would still treat it as a HIPAA compliant response.
Do you also have to be careful like that when they use an anonymous screen name? I know some of the sites don't allow that, but sites like Caring and some of the others do allow anonymous screen names. Are they safe to use the anonymous screen name in replying?
That's a good question. If it's a generic like San Diego Surfer, I would still steer clear of using their name and just going for a more generic response. Nowadays, with the weird names that come out, you never know if it could be their real name or not. So I would still steer towards the caution of trying to call out their initials, their name, or their username under whatever it may be.
Okay, thank you for that. So here's a question about how can we get a false review removed when the review is not honest? So they had a disgruntled reviewer that they felt was stating false information about their staff and facility. And they went on a smear campaign with several review sites. They said that when they contacted some of the platforms, it could not be removed because the reviewer verified her false statement as true. It was their word against hers. This individual feels that's not fair to the facility. Do you have any insights to help folks in positions like that?
Yeah, I would definitely have to take a look at the review. and see where it's spammed. And clearly, I know, Denise, you could speak to this. If it's on caring.com and then it's spammed elsewhere, that's grounds for removal for caring.com. Yelp's a little different and Google's a little different. But what I could do, and it really depends on the content within the review itself. That's what Google, Yelp, Facebook care about the most, not the story behind it. But what we could do, and because we have a portfolio of almost 60,000 negatives that we removed, we can match up to see if we can utilize that along with our services to see if we can help remove it. But if it is a firsthand experience, it speaks to a true firsthand experience and it's from that person, it's probably not going to be able to be removed, but we could help definitely look at it, and it might be able to come off on some review sites, maybe not off on others. But that's where, whether that person asked that question, if you've responded to the review in a very professional manner. But it's something we can look at. And at the end of this, you'll see my phone number, my email. I'll be glad to look into it for you because, once again, as you knew, my stepdad's a retired dentist now, but I know how important a negative review is. And that's what he got hit with, an ex-employee that smeared him all over. And he lost 25% of his business because he went on this smear campaign, which sounds like a similar situation. So firsthand, I've experienced how important it is to address these reviews. So feel free to get my information and I'll be glad to help you out and see what we can do to rectify that review for you.
Thank you, Mark. And you are correct. On caring.com, if that review is published verbatim on multiple other websites, that is grounds for removal from our website. Our guidelines allow difference of opinion within the guidelines. You can contest for fact-based errors. Sometimes businesses get confused between consumer opinion and fact-based statements. That's one of the topics we cover in our Digital Marketing Academy reviews webinars. But specialists like Mark and I can definitely help the business understand the difference there, and understand there's even federal law that protects consumers in sharing negative opinion and not being blocked or retaliated against for sharing negative opinion online. So you just have to look at the specifics like Mark said and the guidelines of the particular platform. Thank you
And
for that.
Denise,
Yes.
yeah, there's another one with Shelly, or someone asked a question in regards to social media posts for a facility as well as post-visit reviews.
Sure.
We shouldn't take, you want to get the patient's authorization to take the picture and post it on the social media sites. That's another area that we actually have a social media app as well, to where you can take a picture and then from there, it turns over and there's a digital authorization signature allowing to use their image on your social media sites. So you do want to get their authorization on social media to use their images or also review responses. I see a lot of people take reviews on Google and put them on their social media sites. So you definitely want to get the patient's authorization.
Yeah, and there was a similar question about that very thing of when sharing verbal or written testimonials, what are the thoughts of using initials of client to help validate the testimonial?
Initials, yes, but you would still want to get authorization utilizing them to do so. So yes, you definitely want to get authorization from the patients. Initials will work to validate maybe on a website, but you'd still want to get their authorization to utilize just even their initials.
Okay, great. We have a couple more questions before we wrap up. And one of them was, I believe you touched on this briefly, but this individual is looking for more information on how to respond to reviews in an efficient manner when they have over 30 locations.
Yeah, so with that, that's where we have the platform that automates the owner's responses for Google and Facebook within 24 to 48 hours. We have 10 different templates per star ranking that auto rotate that are HIPAA compliant, that do not pull in the dynamic field of the username, but it pulls in the fields for the phone number and email to reach out to. So it is timely to respond to all, multiple centers. We do it in a very timely manner because we have that API relationship with Google and Facebook. The reason why we don't do it for Yelp is because, remember, you only have one shot to respond to that review. and you can privately message them to rectify the situation offline to get them to update it or remove it altogether. So with over 30 plus centers to review, it's daunting. So that's what's great about our software platform is it does it for you, and you don't have to rely on an employee that might not know the violations of HIPAA and the turnover, to where it's done and set it and forget it, and you don't have to worry about it, and you're all in HIPAA compliance.
And for Caring, we're looking at integration with Consumer Fusion in the upcoming months. So look for an announcement about that for the listings on Caring as well.
Yeah, we're extremely
Okay.
excited about that.
Yeah, so are we. Okay, so I'm not seeing any more questions, but I want folks to know that if you think of something afterward, both Mark and I are available to answer any additional questions that come to mind. I want to thank everyone who did ask questions, and I just want to summarize because there was a lot of great information covered. So I want to summarize what we discussed and what Mark presented. And that is that responding to both negative and positive reviews is so important for your business's online presence. You need to keep the review responses polite and generic so that personal patient information isn't disclosed and you don't violate HIPAA. Consumer Fusion is a resource that can help your business stay on top of review generation, so getting reviews, review monitoring and responding, and where applicable, negative review removal. And as what I covered, as another reminder, the Caring Stars 2021 deadline is October 15th. Get and respond to reviews right away for those to be considered for that award. Okay, we promised to connect you with Mark. Here is his contact information for you. We're also going to prompt you right after this session with a survey asking you to rate the webinar. And you'll see the option to opt into being contacted by Consumer Fusion. If for some reason there's a glitch and it doesn't appear for you, please email reviews@Caring and let me know you'd like to be contacted by Consumer Fusion, or capture their contact information here, and it'll be in the slides and information we send out tomorrow. This is how to contact our team at caring.com. Really want to thank you, Mark, and the Consumer Fusion team for the work they did to present this information today, and everyone who took time out to attend this session to learn about reviews and HIPAA. We hope you found the information helpful. Please do get in touch and share your feedback and additional questions you have. We look forward to hearing from you. Thank you so much, and goodbye for now.